India and across the world, in Brazil, in the US, in Europe, the acute cases have been increasing so much. I mean, at least 30–40% of children, adults are having cold, cough, fever, pneumonia. Some parts, COVID is coming back again, or whatever they call it nowadays. So homeopathy is back. Homeopathy is back into acutes. Homeopathy is back into treating such kind of acute problems. We talk about a very interesting topic again in acutes, because I wanted to talk to you about acutes and share with you some ideas. So we are going to talk about cough in children. Okay. And probably we will talk about 15 to 20 remedies of cough and how to see that in children. I'm not going to talk to you what is written in the books. I'm going to talk to you about clinical experience, what to see and prescribe. That's it. No problem. We'll go ahead with this. So what I have kind of done is, you can see here, is just for our study purpose, I have divided the entire cough section, entire remedies in cough, into 5 different parts. This is very interesting. And I've tried to create our own little map and flow chart that will help us to study these remedies. This entire presentation will be shared with you on the website, so you can download it. Many people from Brazil and India have been asking about where they get the PowerPoint. Dr. Srishti, please, at the end of today's talk, please announce about how they will get this presentation, where they can see it, because there are many queries about this. Please answer them today. So we have divided the cough into 5 parts. The first type of cough, the first stage of cough, is the initial dry tickling cough. Okay. The second stage of cough is what we call as a more paroxysmal spasmodic type of cough. For example, the first stage is dry tickling, dry tickling cough. The second stage is paroxysmal spasmodic cough, which is like this is paroxysmal spasmodic. The next stage is rattling cough, where there is noise from the chest, like there is wheezing noise. That is rattling cough. And then there is the last stage, which you can call as a later stage cough, okay, where there is a respiratory failure. And then I've added one more topic, which I didn't decide to add, but I realized that in many cases this is very important, and that is intercurrent, which are the important homeopathic remedies which can be used as intercurrent nosodes in cough. Very interesting. Okay. It's very interesting. The last 2–3 weeks, we treated many cough cases, many fever cases. And what was interesting is that I failed in many cases. Now, why this is interesting is because when you fail, you realize what worked, what didn't work. And it also helps you to understand what in a given case to give how much importance. So it was interesting because we gave certain remedies. It may or may not work. And then we reviewed the case again. And then we gave, and then it helped. So it's very interesting to review the case when the patient is not doing well. And that's why this is an interesting topic to talk about, because one of my teachers once very beautifully said that it's more easier to treat. Sometimes it can be more easier to treat cancer cases, but it can be very difficult to treat a case of cough. It can be so tough. So let's start with the topic for today. We will start with the first initial stage. And why this is important is because I have kind of added certain remedies in every stage. For initial dry tickling cough, I have suggested some remedies. For spasmodic cough, I have suggested some remedies. For rattling cough, I have suggested some remedies. For later stage, I have suggested some remedies. But I want to tell you, There is no hard and fast rule that if there is a remedy in a dry stage, it cannot be used in rattling stage. It can. There are some remedies which are there in all the stages. But just for our study purpose and practical purpose, I've just kind of put certain remedies in each stage. I've tried to structureize the topic, and so you will see the talk today a little bit more structurized with the idea of planning of it. So let's come to the first stage. Okay. What is the first stage? Let's see. The initial stage, and we have put about the common, you can say about 10-12 remedies. What are the remedies that we have suggested in the initial stage, initial dry tickling stage? Aconite, mentha piperata, spongia, hyoscyamus, rumex, sticta pulmonalis, Asclepius tuberosa, bromium, nux vomica, manganum aceticum, phosphoric acid. This is the first stage, ladies and gentlemen. Let's go ahead. So aconite, mentha piperata, spongia, hyoscyamus, rumex sticta, Asclepius tuberosa, bromium, nux vomica, manganum aceticum, phosphoric acid. Beautiful. This is the common remedies I've put for you for dry cough. So interesting, huh? So what are the next stage we are talking about? Paroxysmal spasmodic cough. Many beautiful remedies we are going to share. What are the remedies? Close to 12 remedies we are discussing. Cuprum metallicum, Coccus cacti, Mephitis, Ipecac, Causticum, Sambucus nigra, Aurelia racemosa, Mercurius, Pulsatilla, Capsicum, Conium. Spasmodic paroxysmal cough, it is like that. This is paroxysmal spasmodic. Dry tickling cough, we studied the second stage. Spasmodic cough, now we study the third stage, rattling stage. When there is rattling from the chest, grrr, rattling cough. Many remedies there are. Calisulfuricum, one of my favorite remedies. Hiparsulf, natrum sulf, stannum metallicum, sulfur. All the sulfur remedies are there in rattling because it causes absorption of expectoration. Balsam ferruneum, squilla, veratrum album, calimuriaticum, senega, silphium, pulsatilla, antimony arsenicosum, phosphorus, calinitricum, basilinum, ammoniacum. So interesting, no? How we divided it into different stages. Later stages. So there are many remedies for later stages. Antim tart, opium, hydrocyanic acid. In infants who develop cyanosis with cough, hydrocyanic acid. Philandrium, very good remedy. With sweet taste of the cough, like squilla. Nitric acid, sepia, naja. Cardiac issues with cough, naja. Mercury, very good remedy. Mercury, merc sulf, good for pleural effusion. Antimony salt, there are different antimony. There is antim tart, antim ars, there is antim auratum, hyposanium, good nosode, very good nosode. In rattling cough, in respiratory failure, when all remedies fail, hyposanium, causticum, very good for lung paralysis. Involuntary urination with cough, lorocerasus, dry tickling cough is removed magically with this remedy. Intercurrents, this is interesting. What are the interesting intercurrents in cases of cough? Very often you're giving a remedy, it's not helping. What to do? I'm going to give you 5 most important remedies in children's cases.